Okay, sure. I would be really pleased to Dr. Diomusi Kabulo. Dr. Kitanaga Kabulo is a very brilliant neurosurgeon from Congo. He has completed his training from Zimbabwe and has always been really active in all the neurosurgical academic activities, from attending various workshops around the world and delivering his talks and sharing his research work, and also attending all those webcasts and sharing various talks on different topics. So it's really a matter of great honor to have him today at this webinar on updates on brain surgery. Dr. Kabulo, the floor is yours, and again, thank you so much for coming.
Thank you so much, Dr. Noor. Thank you, Dr. Bennett, for inviting me. And it's a pleasure to meet again, Dr. Nuru, one of my best friends. We always meet when we go and learn abroad. Thank you so much. So I will talk about the update in neurosurgery in Congo. My talk for today is not educative, rather informative. I just prepared something to tell you how neurosurgery started in Congo and where are we today and what we are doing and how it's risen up to now. So all pictures I'm going to show today about patient, I got consent from patient. So I only selected a few cases from patient I managed to reach. Neurosurgery, like everywhere in the world, comprise surgical intervention involve the management of central and peripheral nervous system. So this is Congo. This is my country. Is the second biggest country in Africa after Algeria. Algeria is the first one. Congo is the second biggest country. And in Congo, in terms of population, it's the fourth one. So Nigeria is the first. Congo is the fourth populated country with about 95 million population. And with that 99 million population with only 14 neurosurgeons. So the history of neurosurgery in DRC, how it started, the first neurosurgeon was Professor Shako Junga, who was born in 1938 here in DRC. And he graduated from Free University of Brussels, where he did his medical school and also his training in neurosurgery. And thereafter, he completed his fellowship in New York, where he did also his PhD, and came back to Congo, and he worked from 79 to 86 in Kinshasa, the capital city. So at that era, it was very difficult because he didn't have CT scan, MRI scan. So he was just using X-ray, sacroradiography or carotid angiography. Unfortunately, he died too young at the age of 48, leaving a void in neurosurgery. But the moment he was working with some doctors like this Dr. Belchika, Antoine, who was working with him, and he left at some point, went to do his training in France, and he graduated in 1987. So he came back and started now after Professor Shako died. So Dr. Belchika, when he started to practice, that when the CT scan was brought in DRC. Like you can see, the first pictures was horrible. So it was in 1988. Then there's another Congolese who works in Belgium, who was now coming to cover, and Professor Kalangu, who is well known in the world, who is the head of department of neurosurgery in Zimbabwe, and he's also the director of postgraduate training. He's the past second vice president of WFNS. So he started also to come from 2008 to 2016 as a visiting professor at the University of Lubumbashi in my town, where he was giving lectures. And from 2016, he was appointed as a professor at the University of Lubumbashi. He is now the head of neurosurgical unit at that university. And he started also his private practice since 2016 here in Lubumbashi at this private hospital, where he has 2 operating microscopes. He has also CUSA. He has, good instrument for neurosurgery. And at that hospital, we do major operations. We can do even skull-based tumors. We do also scoliosis surgery. So this is the group we call like a transition group from the old to youngest. So there are these guys who came. There's Professor Nsambi, who was a general surgeon. He went to train in Belgium, and he came back in 2012. He is the current head of department of neurosurgery in Kinshasa and the director of postgraduate training in neurosurgery. So also 2 came from Senegal and 2 came from Morocco, who trained, like Dr. Jeff Talaja trained in Rabat Center, and Dr. Ngamasata. We only got the first MRI scan in 2014. That's when the MRI scan came to DRC. And from that time, because the number of neurosurgeons were now, the number was increasing, neurosurgeons from diaspora were now coming to help, like I mentioned before, Professor Kalala, Professor Kalangu, Dr. Makese. They were coming from abroad, coming here to help. And then after the transition time, young neurosurgeons came from 2019, 2020. 4 neurosurgeons came back, first to Dr. Shweka from Zimbabwe. Dr. Sarah was the first female neurosurgeon in Democratic Republic of Congo. He graduated from Senegal in 2019. Then Dr. Denis from Senegal, and I joined coming from Zimbabwe. And 2 more came with the second female neurosurgeon. We have so far 2 female neurosurgeons here, and they came back with Dr. Feruzi. They came from Senegal, and this is the youngest neurosurgeon, Dr. Ngayenga, who just graduated from University of Zimbabwe in December 2021. He joined also, which is now making in total permanent neurosurgeons 14 for this biggest country. We have 6 in the capital city. We have 6 also here in Lubumbashi, the second city where I work, and 2 in the east of the country in Bukavu. So 14 neurosurgeons. So in November 2015, the Congolese Society of Neurological Surgeons was created in Kinshasa. And in 2019, the colleagues from the other Congo, Brazzaville, they joined the society instead of having 2 Congolese societies. So they joined our society. We have only one. So you see the logo moved from this one, and we have now this logo, which is having both 2 flags from this Congo Kinshasa and Congo Brazzaville. Now, like they say, if you learn something new, your future brain will thank you. And Albert Einstein said, once you stop learning, you start dying. We want to learn more. So what is our perspective? We want to develop now subunits in Congo. So we want to push young neurosurgeons to do their fellowship, to do subspecialties, so we can have many subspecialties, and we will know that if it's vascular, we will send to this one and to this one. That will help again our neurosurgery to go ahead. But so far, we have 2, Talaja and Sambi from Kinshasa, who did a course. They have a diploma in Arab spine course. And we have also this professor from Kinshasa who did a fellowship in neurovascular in Japan. And 2 also did skull base, Dr. Ngamasata and Sambi. So in training, so far we have more than 27. They are in Senegal, Morocco, and so on. But in DRC, we have 7 who are in training in the capital city in Kinshasa. Most of them are general surgeons. So this is my country. This is Kinshasa. So if you can see, before 2013, there was only one center where neurosurgery was being practiced, and everywhere else in the country there was nothing. And after 2013, you see there is now Kinshasa. This is my town, and that is Bukavu there. And this very soon we'll go there. There will be also a neurosurgeon. So you see, to fly from my town here, Lubumbashi, to Kinshasa, it's 2 hours, 10 minutes. So patients were suffering, and patients who didn't have money at that time were dying because they couldn't fly to go and follow neurosurgeons there. That's why at some point, there was one neurosurgeon from Kinshasa, Dr. Ntalaja, who was flying to Lubumbashi to cover for 1 week, 2 weeks, then he goes back and so on. We also do with the society some humanitarian missions, like we do hydrocephalus and spinal bifida camps. We did in different towns, and more than 100 kids were operated. So we are moving around the country to operate. Like you can see here, this was in Lubumbashi. There are also pictures from Goma in the east of the country. In terms of scientific committee, scientific organization, in our society, we have now a scientific committee where we are talking about research. And also we managed to organize in 2019 a very big international conference in Kinshasa, in the capital city, where neurosurgeons from Europe, from all over Africa came to attend to that conference. And the president of WFNS that time met our president, and they spoke. The president promised to help the Neurosurgical Society. So then our giant met at the University of Kinshasa. Then they spoke about the schools. That's the time they decided to open neurosurgical schools in Congo. So far it's only in Kinshasa where the school is already working, and here in Lubumbashi, the next academic year, the School of Neurosurgery will start. So we'll be training neurosurgeons locally with Professor Kalangu. In Kinshasa, there are also Professor Nsambi and others. So here in my town, neurosurgery is being practiced in public hospital, 2 public hospitals. This is the provincial hospital where I work, Jason Sendwe. This is the university teaching hospital. So the public hospitals, those 2, the neurosurgeons, we are practicing there. But in private, I will just give a case of a private practice where I work. This is a Coptic hospital from, this is Egyptians, doctors who build this hospital. So we do also major operations there. Like you see, this was like the end of our rods and screws, a successful rods and screws fixation. And at the end of the operation, we took a family picture. This is the mite anesthetist I work with at that hospital, Dr. Kiro from Egypt. And there was also a team coming from the capital city. This is the anesthetist from Kinshasa, Dr. Richard, and the neurosurgeon from Kinshasa. This is only professor we have of anesthesia here in Lubumbashi. He's a Congolese. So we also work with him, and we also do big surgeries with him. Like there you see that skull tumor we removed last week. And we also do spine, we put cages, we do grafting, we take iliac bone and put plates, we do rods and screws. This case, this is our colleague. Like I told you, I'm showing you videos, I'm showing you faces because I got informed consent. This is our colleague. This is the youngest neurosurgeon who just joined. This is me. This is our colleague. We trained together from beginning to the end in medical school. We finished together, but he came with 5-month history of complete loss of vision. And when we did a CT scan, we saw this huge lateral sphenoid wing meningioma. So we operated him yesterday. This is the picture of yesterday. And this is the part of the tumor we took for histopathology. Today, I can switch off the light, and he can recognize that the light is switched off. If I switch on, he sees the light, but he was completely blind before operation. Already 24 hours post-operation, he can appreciate light, which is a good sign. We'll see, and tomorrow we'll do a repeat CT scan we'll see what will happen. So what are the reasons of delaying evolution of neurosurgery? Lack of funds. The health system in Africa in general and in DRC is based on public health priorities in which neurosurgery has no place. And also the main challenge is young neurosurgeons. When young neurosurgeons are finishing their school, they have difficulties to be integrated into the system, public hospitals or universities. When they come back, I remember one time a neurosurgeon came back and applied to the university. They were asking, do we need him? So that is also a big challenge for them to get integrated into the system. Lack of neuroanesthetists and neurointensivists, lack of training centers. It is also delaying neurosurgery, and also limited access to basic neuroimaging. So challenges we are facing, you can see, we have to motivate young people. We have also, there is access to microsurgery training. We need also that in this side. But usually we have late referral of patient and economic challenge. Patients are reaching us because before neurosurgeons, general surgeons were helping us to see patient, to operate, to do few small cases. And now there are cases which were working, there are cases which were doing well, others were wrong. So people, to convince them to come and get operated, they are sometimes like reluctant. They don't want, they say, no, if they touch your brain, your spine, you won't walk anymore, you die, and so on. Or sometimes others, they don't know that now they are neurosurgical facilities. They keep patient until it's now late, then they send patient. Like you see this young boy who, it's a very rare case of very deep intracerebral hemorrhage. He was involved in an accident. He was riding a motorbike, and before he came here from far, and Glasgow Coma score was 9, and he started to deteriorate. His brother said, please, can you do something? We just did an extended bell. We aspirated that hematoma, and you see this is 4 days post surgery, and this is, he was hemiplegic, and now he could walk. And went back to his village. This baby was born with myelommeningocele, with the meningocele and the hydrocephalus. So the doctor who was close to the family was telling them, now those patients don't grow up. If you try, they will die. Just leave the baby to die, and so on. But we tried to convince the family and operated the baby, see how beautiful she is, and she can walk now. So those are challenges we have. And in terms of equipment, before 2014, CT scan machine were few. Like in my town, we had only 3, but now we have 6, and there were no MRI scan machine. And now we have 2. 1 is not functioning, we have 1. And in capital city, we have more than 30 CT scan machine and 6 MRI scan. So in conclusion, the number of aging population is expected to rise abruptly in the future, such that more than 1 in 6 adults globally will be 65 years or older by the year 2050. So advancing age of the elderly would obviously correlate to a rise in the burden of neurosurgical disease. And rapid technical and technological advances in the neurosurgical field in the past decade, like you saw, have revolutionized better outcomes and prognosis for patients in DRC. So I insist again, we need to push young neurosurgeons to do subspecialties so we can fill some gaps in Congo. These are my few references. Thank you so much again.